Welcome to Mater Misericordia Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located between Tomboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.
Everyone, good morning and welcome to our Health Friday today right here on Capuchin TV, brought to you by Capuchin TV in partnership with Mater Misericordia Hospital. Today being a beautiful morning, though chilly, the 17th day of December 2021. We warmly welcome you for this discussion that will help you understand this topic, gastrointestinal tract diseases, specifically focusing on Helicobacter pylori, commonly known as H. pylori. If time allows, we are going to touch on some of the common other disorders of the gastrointestinal tract. And with me in studio is Dr. Calvin Owiti, who will be taking us through this condition by giving us more insights on what this condition is all about, the signs and symptoms. I know some of you have been asking, can H. pylori lead or cause stomach ulcers, stomach cancer? Don't you worry, you will get to know all the complications associated with the untreated Helicobacter pylori. Dr. Calvis,
yes,
welcome to our studios.
Thank you.
Thank you for making time for this talk.
Thank you very much.
All right, there's an outbreak of influenza in most parts of the country. I don't know if you have been affected.
Me personally, probably not.
You've not been affected?
Not, yeah.
And there are very hilarious memes and puns doing rounds on social media that if you're not affected, then you belong to some sort of cult or what? The infamous Illuminati?
Yeah, I've heard of the same. Quite a number of people are complaining actually about a flu that is raging.
Yeah, so wherever you are, try to keep warm, try to take some concussions or whatever prescriptions you get to ensure that you remain strong to run your responsibilities. Remember, you can be part of the conversation. As usual, we value your feedback. So send us your questions, send your feedback on our social media platforms, Capuchin TV Network, that is on Facebook, Twitter, and YouTube. Our number remains 0717-424-866. You can send an SMS, our paid SMS line, that is 21760. And welcome. My name is Sasha Elizabeth, and let's talk health. This is Gastrointestinal Tract Diseases, H. pylori. So Dr. Awiti,
Yes.
when we talk about the H. pylori, what do we refer to?
H. pylori, in full, Helicobacter pylori, is a bacterial organism which is present almost everywhere. Yeah, the sources are so many. Primarily resides in the stomach. So it's a small organism made up of a single cell, and is capable of moving actually. It's a small organism that is capable of moving and survives under low oxygen concentration, so it can survive nicely in the stomach. And it's also able to circumvent the protective mechanisms of the stomach. You know there's a very concentrated acid in the stomach, the hydrochloric acid. So that organism is actually able to survive under that environment. Yeah, so that is the organism that we're talking about. And there are so many illnesses that are associated with it, primarily in the gastrointestinal tract.
Okay, thank you. Thank you so much for that clarification. So now, what are some of the factors that predisposes one to H. pylori?
The main factor is poor hygiene and sanitation. That is the main factor, because the route of transmission is there are two possible routes. Either fecal-oral, we call it fecal-oral because you consume contaminated material. Usually, people are a bit political about it, but the essence is, if we mention fecal-oral, you're actually consuming material that is contaminated with fecal matter that has H. pylori.
So that is debatable, or it's the fact?
That is the fact. Yeah, but we don't say it. We sugarcoat it a bit. So that is the fact. Then the other possibility, the other route of transmission is oral to oral. So you can actually get it from a fellow human being through oral route. Yeah, so the main predisposing factor is poor hygiene and sanitation. Yeah.
How contagious is it?
Can be pretty sure if you get exposed to sufficient dosage, you will get it. Yeah, you'll get it. So long as you consume it and the infectious dose is achieved, then you will eventually get it. It will eventually get to your system. Yeah.
And what is the prevalence rate? Is it a common infection?
Yeah, it is postulated that close to 50% of the population, 50% of humanity has H. pylori. Well, not everyone who has H. pylori infection actually gets the diseases associated with it.
That's an indication that we do not really, like our hygiene or sanitation standards are lacking.
Yeah, and it's common in developing countries actually, and people who come from low economic state, low social status environments, basically.
All right.
Yeah.
So please share with us some of the earliest signs and symptoms of this infection.
Yeah, being that the primary site is the stomach, the usual complaints are basically gastrointestinal in nature. So one may have nausea, you get abdominal discomfort, some people get heartburn, bloating, constipation, sometimes diarrhea, sometimes vomiting. Yeah, so those are the common, and generally a feeling of indigestion. So primarily gastrointestinal symptoms. Well, at some point, if there are complications, someone may get other things like weight loss and even anemia, fatigue. But those are late signs that are associated with complications of H. pylori infection, especially if it is not treated.
What are the severity levels, and are the symptoms different from the mild level or condition to the severe one?
Yeah, people actually people are different basically. There are people who get very mild symptoms. There are people who just present with nausea only, and there are people who just have vague abdominal discomfort. But in very severe cases, you get people who cannot tolerate any meal. They are having vomiting, diarrhea, fatigue, and some are, in some cases you can even get someone losing weight and vomiting blood, yeah, or passing stool that is blood stained or black stool. So at a fairly advanced stage, but the symptoms vary from one individual to another.
Okay, some of the signs and symptoms that are exhibited when someone is infected by H. pylori could also be an indication of a different medical condition altogether.
Yes.
So how can one differentiate this?
Now, it may not be easy for an individual to differentiate. That's why someone needs to go to hospital.
The best way, to seek medical attention.
Because there are many other illnesses that may mimic H. pylori infection. Take, for example, abdominal pain, basically in the upper part of the abdomen, called epigastric pain. There are many other conditions that can cause epigastric pain. There are many organs around there. We have the stomach, we have the esophagus, we have the liver, the gallbladder, we have the pancreas, and the spleen. So an inflammation in the pancreas, the so-called pancreatitis, can cause epigastric pain. A stone in the gallbladder with an infection can cause the same. Liver inflammation can also cause the same. But also in certain individuals, especially the elderly and people with diabetes, you may get epigastric pain that is not necessarily associated with H. pylori. It could actually be a heart attack. So that is a gray area. Yeah, so someone needs to be careful. When you have epigastric pain, it's not always H. pylori. It could be something more serious than it actually.
So the best thing to do is to visit a medical facility for checkups. So when someone comes to the medical facilities with such symptoms, signs and symptoms, how is this infection diagnosed? What kind of tests are performed on them?
Okay, so once we gather, it's basically evidence collection. Yeah? So once we get the symptoms and we conduct a physical examination, there are a variety of tests that may be recommended. There are two actually. There's a stool test, there's a breath test, and you may also do a blood test. But let me start with the stool test. In the stool, we basically test some antigen of H. pylori. So you get a stool sample. If that antigen is positive, most likely you have H. pylori. There is a breath test where we just
breath test. That's quite interesting.
Yeah. So that breath test, we basically label urea because H. pylori is very interesting. It contains some enzyme that can break down urea. So we give someone urea that is labeled. One of the carbon atoms there is labeled. So you consume that one. When it gets to the stomach, the H. pylori organism will break it down. So when it breaks it down, it produces carbon dioxide, which gets into your blood, and then you breathe it. So when you breathe it, we measure the concentration of that labeled carbon. So that is the so-called urea breath test. It's not quite common. Mostly we use the stool H. pylori antigen test. It's a bit easier. Yeah.
And the blood test?
The blood test basically tests antibodies. They are long-term antibodies against H. pylori. It may not tell you much about, especially there are people who will have a positive antibody, not necessarily because they have active infection, but because they have had a previous infection that may have been treated. Yeah, so we don't use it more often. Yeah, it indicates past exposure most of the time. Yeah, so the two gold standard, there's two most important ones, a stool and urea breath test. But there are other tests. Depending on the indication, there are people who will have to undergo endoscopy, the upper GI endoscopy, where the fiber optic tube material is inserted into the mouth, and then the surgeon is able to visualize the stomach. So when they visualize the stomach, they're able to get a sample from that, the stomach tissue. That sample can, there are so many things that can be used with that's done with that sample. One, you take for histology, see under a microscope and see whether there are other pathologies there. Is there a transformation to something else? Is there, and then you can also check if H. pylori is positive from that biopsy specimen. Yeah.
So what could lead to that higher level of diagnosis? Could it be the failure of these three methods that you've mentioned before?
Not really. The endoscopy is indicated in certain individuals, especially an elderly person presenting with features of H. pylori infection. You most likely that such a person will undergo endoscopy. And there are also people who present with severe symptoms. Someone presents with vomiting blood. So if someone vomits blood, you definitely want to see what is going on with the stomach. So you have to do an endoscopy. There are also people who present with black stained stool or bloody stool. So those people will also undergo endoscopy. There are also people who have undergone H. pylori treatment repeatedly and it's not going away. So such people also will undergo endoscopy.
Thank you. Yes, thank you, Dr. Witi. Now, first, before we get to the treatment modalities of H. pylori, please tell us, is this infection curable? Can someone be fully cured and declared free from H. pylori infection?
Yes, it is.
Good. So now, what kind of treatment are available, treatment options for this infection?
Yeah, so the treatment modalities, being a bacterial organism, we need antimicrobial agents, antibiotics. But not only antibiotics. Remember, there are symptoms that are associated with H. pylori. So there are two things. We target eradication of, we aim at eradication of the organism, but also we control the symptoms. Now let's start with symptomatic control. Symptom control requires acid suppression. Because, remember when the H. pylori is in the stomach, the system is basically under stress, and someone may have an ulcer, not always, but a number of cases. So you need acid suppression therapy. There are drugs called proton pump inhibitors, one of them being omeprazole, esomeprazole, those zoles. So that is number one. So that will allow the stomach to heal even as antibiotics continue to work on the organism.
So you basically treat symptoms.
So you treat the symptom. Number two, eradicate the organism. Now eradication of the organism is not easy. Yeah.
How complicated is it?
Because you don't use one antibiotic. Usually use two antibiotics plus a proton pump inhibitor, the acid suppressant. And the antibiotics are taken for quite a long time. Not so long, but 2 weeks, 10 to 14 days, basically. Yeah, so it's antibiotic and it's symptomatic control.
Okay.
Yes.
They might really sound, the medical jargons might be a little bit complicated and difficult for our viewer to decipher the meaning, but the most important thing is to understand, because when you are asked to perform this test or to go through a certain procedure, you already have an idea of what is expected of you. So there's this question that is common. People really nowadays have embraced Google, the digital platforms, to diagnose themselves and also self-treat over-the-counter medicine. Can this infection go away without treatment? Or is it okay for one to self-diagnose and take the OTCs?
Basically, H. pylori, as we've said, 50% of the population have it, and not many of them have symptoms. About 15-20%, only about 15-20% have symptoms. Then 90% of people with intestinal symptoms of gastritis or ulcer, peptic ulcer, actually have H. pylori. So if you don't treat it, it's likely to continue staying there because it can survive the stomach acid. It will stay there. It may give you symptoms, it may not.
So for those who are asymptomatic, how can they tell? Because you know you need some red flags for you to be able to seek medical attention or to act accordingly.
Usually, it doesn't make so much economic sense testing everyone for H. pylori. Remember, 50% of the population, Kenya, we are about 60 million. So imagine 30 million of us undergoing H. pylori test. So we don't bother. Those who are asymptomatic, we don't bother. We only test once someone has symptoms, and then we eradicate. Once we diagnose it, we eradicate the bacteria.
So you recommend people to make frequent visits and get tested for H. pylori?
Yes. If they have symptoms, they go to hospital, we check them.
What about those who don't have, who do not present any symptoms?
Those who do not have symptoms, basically we don't bother. They are not, most of the time we don't recommend routine tests for H. pylori.
Oh, okay.
And we don't.
How serious can the condition get? No, maybe before we get to the complications of untreated H. pylori. Well,
we've said people are symptomatic. Some people are symptomatic. Because for someone to develop the disease, remember there's an organism and there's a disease. So you have H. pylori, doesn't mean you have a disease, the diseases that are associated with it. You have to have a susceptible host, a susceptible human being to develop symptoms from H. pylori infection. Yeah, so the people who are susceptible, those are the ones who present with symptoms, and then we diagnose them with H. pylori and eradicate. Now,
so those who are asymptomatic, that means there's no cause for alarm?
We usually don't, you don't treat the organism, you treat the patient. So
absolutely.
Yeah, we don't disturb them.
Okay.
Unless there are certain indications for
all right,
for
all right.
Yeah.
My director says it's time to take a break. Remember, your health is the greatest investment that you'll ever do on yourself. It is your responsibility. Health comes faster, and it is the priority before anything else. We take a short break. We'll be right back with more on Health Friday. Do stay with us.
Welcome to Mater Misericordia Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located on
Patients' quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. Get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospitals.
To our second session of our Health Friday Talk. We are glad you're still keeping us company here on Capuchin TV. With me in studio is Dr. Calvin Owiti, a medical officer at Mater Misericordia Hospital. We believe you're still gleaning something as he educates us more on gastrointestinal tract diseases, focusing on H. pylori. Now, remember, you keep your questions and concerns coming, and we'll make sure we get him to respond to them, even at a later stage. If that is, if you'll be watching this later on, we understand that there are those who are still going on with their routine and work. So, before we went for a break, we were trying to understand there are those who present symptoms and those who are asymptomatic. So I asked a question that I feel maybe we can try and respond to it conclusively. How serious or how fatal can asymptomatic patients get?
Yeah, thank you. Patients with asymptomatic H. pylori infection may remain asymptomatic for long, but then a trigger may happen. Either they start taking too much alcohol, so they get alcoholic gastritis. At that point, when you see a patient presenting with gastritis, you want to do a H. pylori antigen test. So at that point, you may find H. pylori positive. If you find it positive, then eradicate it. But it may not necessarily mean that that is the cause of gastritis. However, gastritis, as we know, the more we have factors working against the stomach, the worse it becomes for an individual. So alcohol, H. pylori, plus other things, plus certain medication, may actually make someone have symptoms, and then you find H. pylori in the mix. So you get confused, but you eradicate it if you find it.
Okay.
Yeah.
Mentioning alcohol, there are some substances which can cause reactions or even render the treatment ineffective when someone, that's when ingested. Is it advisable to consume alcohol after after testing positive for Helicobacter pylori?
Actually, it's not. And there are many reasons. One, alcohol will worsen the symptoms of whatever is going on in the stomach. If it is gastritis, it will worsen it. If there is an ulcer, because there are people who have peptic ulcer disease just because of alcohol alone. So it will worsen symptoms. And number two, there are certain treatment modalities that do not rhyme with alcohol. If you take, for example, one of the medication used, metronidazole, in other words, flagyl. So someone taking that kind of drug should not consume alcohol because the side effects are not nice. Yeah, so it's not advisable at all.
Because before, people used to ask if they can take milk, but there's a growing rate of alcoholic consumption of alcoholic beverages. So that's why people tend to ask when they get prescriptions, can I consume alcohol when I'm... What about those who have not started treatment?
Well, it's still not recommended. You know, alcohol is not so important. People take it to get proud a little bit, but alcohol is not a useful drug. It's not so useful, except for using a sanitizer or other things. So, if someone has H. pylori and consumes alcohol, you can predict the symptoms are likely to get worse. Yeah. So
Thank you, Dr. Owiti. And remember, also that we will sample some of your questions, some of your feedback, if time allows, so keep them coming. Just to remind you, our number is 0717 424 866. Our SMS line is 21760. Now, sometimes we have, we get a condition, asymptomatic or symptomatic, but then later on, we delay maybe to take treatment, or you get partial treatment before you heal. You decide to quit the treatment. What are some of the complications of untreated H. pylori infection?
An interesting question. H. pylori left untreated, there are many complications, many potential complications. We start with the simple ones. You get the disease associated with it. One, you get gastritis. You can get an acute gastritis presenting over maybe a week. That gastritis is basically inflammation of the stomach and can actually give you most of the symptoms that we talked about. And number two, you get a chronic gastritis. H. pylori has been there, it lives in your stomach, so there's constant inflammation in the stomach. And then at some point, now, so the stomach cells can actually undergo what we call atrophy. So they kind of die off, and there are complications of that as well. Another level of complication is development of tumors. So someone can get cancerous lesions in the stomach. Yeah.
So that means it can cause stomach cancer.
Yes.
That responds to the question.
And then we've left out gastric ulcer disease or even duodenal ulcers. Yeah. And in the mix, you may get bleeding or blood loss. That may be dramatic or maybe just occult. You get chronic blood loss and you get anemic over time, or you could get overt bleeding that presents with trauma, and you have to rush to hospital. So those are some of the complications. The other complications that are not confined to the gastrointestinal tract, like there are patients who present with low platelet levels because of certain immune reactions that occur during H. pylori infection. There are certain antibodies that are produced against H. pylori that can react with other parts of the body and can cause problems.
Can stress cause H. pylori, or how does H. pylori or stress affect a patient with H. pylori?
That is very,
two different
very
questions.
Interesting question. Yeah? H. pylori is fecal-oral or oral-oral. It's an organism. It's not related to stress. However, there are symptoms that mimic H. pylori infection. There are people who have what we just call functional dyspepsia. They have abdominal disturbance, not because of anything. Yeah, so that group of people you may say when they are stressed, then they develop symptoms that mimic H. pylori, but it's not actually H. pylori. The kind of stress that can cause other symptoms that may mirror H. pylori so closely is physiological stress. Not the usual stress of examinations and finances. So physiological stress.
So what is this physiological stress?
Physiological stress, when someone is unwell for other reasons, someone has a burn, someone has some other infections like COVID-19, someone is an accident survivor, or someone is admitted in the ICU. So they may get a stress ulcer. So the body works in a mysterious way. If one part of the body is stressed, the stomach will be stressed. That brings us to the psychological stress. Although it's refuted that psychological stress is not associated with stomach ulcers and gastritis, you still see a number of people present with such symptoms suggestive of gastritis when they are undergoing certain emotional moments in their lives. But it's a controversial subject. Yeah.
Indeed, it's really a complex subject that really requires time to discuss and debate more about it. And please tell us about the dietary recommendations for patients with H. pylori.
Okay, thank you. Now, most of the time you get children sent from school, and then they want a medical report with dietary recommendations. What we do, we do not warn or recommend any specific diet for patients with H. pylori, but there are certain dietary adjustments that may benefit healing. Yeah, someone with chronic gastritis and with inflammation in the stomach, certain products that contain what we call antioxidants, the likes of omega-3 fatty acids, those ones can be useful in promotion of healing. Adequate protein diet, because protein is required in healing. And then there are certain substances like so-called probiotics. Yogurt is one of them. Yogurt contains certain organisms that can compete the abnormal organisms in the gastrointestinal tract. That can help in limiting other infectious diseases of the gastrointestinal tract, like amoeba and even typhoid, many others. So those are some of the things. But we do not advise anyone against taking any type of food, because people are different. There are people who tolerate sukuma wiki, others don't. But it's upon the individual to identify what they can tolerate and avoid it.
Thank you,
Yes.
Dr. Witty. Allow me to go through some of the feedback. Julian Emil, wow, it is so amazing. Yeah, indeed, it's amazing. Thanks for helping the citizens. Sure, thank you. There is a call, and someone who would like to talk to the medical officer, so Dr. Witty will talk to him or her shortly after we close this discussion. So as we head towards the end of the discussion, allow us to get to understand more about the challenges that you encounter during treatment of gastrointestinal tract infection, specifically H. pylori.
Thank you. The main challenge is actually adherence to treatment. And there are so many factors that limit adherence to treatment. Number one is the pill burden. Now, we have 2 antibiotics at least and another drug. So those are 3. And you take them for 10 to 14 days. So not many people can tolerate that. So a number of people will take them for 5, 7 days, and then they are tired. Now, then they come back with symptoms again, and you diagnose H. pylori, and then you get back to it. So it becomes a vicious cycle. So adherence is quite an issue. Other side effects there are also side effects that limit adherence. If you take antibiotics for long, basically someone is likely to develop diarrhea. Yeah, and the mechanism is the antibiotics will wipe out all the other organisms, and the ones that are resistant, or the fungal organisms, will overgrow and cause diarrhea. So people don't like that. Another side effect is vomiting with some of the drugs. So people also don't like that one. Yeah, so those side effects and the pill burden is an issue. That brings us to antibiotic resistance. You continue taking half doses and you are back to hospital. It reaches a point where no antibiotic can actually work on eradication of H. pylori.
Okay.
Yes.
Thank you, doctor. There is a question here. Frida from Eldoret is asking, I got ulcers. I think it's one of the complications of the gastrointestinal. I got ulcers treated and got well. I checked on my H. pylori and it turned negative. When I eat some foods, I feel itchy and full, like bloated. So I think she meant bloated. So what might be the issue? She was checked and I think she tested positive for H. pylori. No, she tested negative. But when she consumes some foods, she feels really bloated and some itchiness. What could be the issue?
So persistence of symptoms after eradication of H. pylori. There are possibilities. One, it may actually turn out that there were other factors that led to symptoms that actually led to the diagnosis of H. pylori. Probably there are other drugs involved, aspirin, some drugs so-called NSAIDs like ibuprofen, those ones. they are not so good with the stomach. Steroids also. So there may have been certain factors that triggered the symptoms that led to diagnosis of H. pylori. Number two, it may actually be a functional dyspepsia, what we call a functional dyspepsia. So you eradicate H. pylori, but you still have those symptoms. Yeah.
So what's the best intervention for Farida?
Now, if symptoms are continuing, and you are still, she's still having gastritis-like symptoms or exhibiting overt symptoms like melena, blood-stained stool or dark stool, vomiting, the best thing to do is to actually see a gastroenterologist, and an endoscopy may be recommended, and then to look at what is happening in the stomach. Most of the time, you may actually realize there is nothing actually going on. It's just a functional thing with oversecretion of the stomach acid for unknown reasons.
Thank you, Dr. Witi. Now, now that we have a few minutes, could you please take us through, just to mention some of the other conditions that affect, can be linked to or categorized under the gastrointestinal disorders?
Yeah, so thank you. The other illnesses, in the same spectrum of peptic ulcer diseases, we can mention a few. There's what we call gastroesophageal reflux disease, or simply put, reflux disease. So the main complaint there is usually heartburn. So there are people with H. pylori that also complain of heartburn. So it can get so bad until you can't swallow, or you get a chronic cough, or you get persistent acidic taste in the mouth. So that is one, gastroesophageal reflux disease. There are other illnesses in the gastrointestinal tract, infectious or non-infectious. Let's deal with a variety of infectious diseases. We have food poisoning. I think that one was discussed last week, the other week. So food poisoning is one of the gastrointestinal disorders of infectious origin. The other non-infectious diseases like pancreatitis, basically inflammation of the pancreas. The main trigger is alcohol, or the other things that are associated with it. There's inflammation of the gallbladder, with or without a stone, called cholecystitis or cholelithiasis. There is inflammation of the liver, we call it hepatitis. Those are some of the, and hepatitis can be hepatitis caused by a number of things, alcohol, some other drugs, or even infectious, hepatitis A, B, C. Or autoimmune conditions, basically conditions that are associated with antibodies produced against self, destroying someone's organs. Other disorders of the GIT, appendicitis is one of them, which most of the time is a surgical condition, and usually presents with pain on the right lower part of the abdomen. It's a surgical condition and it's an emergency. There are other illnesses like Crohn's disease. We call them inflammatory bowel disease. Presents with inflammation, and sometimes you may get a bit of bleeding, and it's not a nice entity. And then we talk of the cancers of the GIT. You can get cancers of everywhere, basically.
All right, time is against us, but Steve from Nairobi, I wish to talk to the doctor on an issue. Maybe after the show, kindly share your contact. So as you give us your parting shot, and if you'll have time, if it's okay with you, you can share your contacts with them so that they can call and seek clarification, because some of these issues are really personal and some people don't prefer them aired or talked about on air.
Yes.
Your parting shot, please.
Just as you said, H. pylori is a common infectious organism. Many people around the world have it, about 50% of the population. But 90% of people with symptoms of gastritis and other entities associated with gastritis actually have H. pylori. So it's important to get checked. You conduct that kind of test, and if it is found, it should be eradicated to avoid complications that we have discussed. Thank you.
Your contacts? Or do you prefer talking to them here?
Yeah, I can share my contact.
You can share your contact and probably an email for
yes.
those who'd like to send an email.
Yeah, so my number is 0704 584 778. 0704 584 778. Or you can, my email is owiticalvins7@gmail.com.
owiticalvins7@gmail.com. The number is 0704 584 778, right?
Yes.
Thank you very much, Dr. Witty, for creating time to take us through this informative discourse. We really appreciate that.
Thank you very much.
All right, dear viewer,
yes.
Time and health are two precious assets that we don't recognize and appreciate until they have been depleted. It's very important for you to gain or amass more knowledge on different medical conditions, different health practices, and that's why we continue to bring you this session and informative discourse on health every Friday, and we thank you all for always making time for this, for your feedback, for your questions and inquiries. That really speaks volumes when it comes to feedback, so we appreciate that. At this point, let me take this early opportunity to thank all our viewers for always being with us. There are those who might not be able to follow maybe our subsequent programs, but wherever you will be, provided there is internet connection, you can always do that on our social media platforms. So I thank you, dear viewers, our supporters, our partners, including Mater Misericordia Hospital, and our benefactors. Thank you very much for standing with us as we prepare to celebrate Christmas and, of course, usher in the new year 2022. I'd like to thank you all for your support so far. The management, the Capuchin, Franciscan Capuchin Friary, we thank all the brothers and priests, and represented by Father Vincent Shumira and the director, Father Peter Waweru. We thank you all, and all the journalists at Capuchin Television Network. Thank you very much for your efforts. Thank you for your commitment towards evangelization in this Catholic broadcasting ministry, Capuchin Television. And today's crew, our camera person has been Evans Havana, assisted by Felix Juma. Our sound engineer has been Frederico Chenge, aka DJ Fredox, and our visual mixer most of the time is Samuel Cherubor. On the other side of the gallery, in the transmission desk, we had Peter Mwangi and Kevin Kitavi Zisal. Thank you all for making time for this show. Journey masses to all those who will be traveling or planning to travel to different destinations. Stay safe and healthy wherever you are. Call me Captain Asasha or Asasha Elizabeth. See you next time. Goodbye.
Welcome to Mater Misericordia Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located between Tomboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.